Okay, I've been asked to do a video all about the physical health impact of alcohol, which is huge. So I'm going to try and give you the headlines, yeah? So before I get stuck in, the best book for facts around alcohol is Drink by Professor David Nutt. I highly recommend you get that book. Yes, maybe it's a little bit heavy, but you can listen to it 5 minutes a day or just read a few pages a day. It's really important because it's that factual information about alcohol that's going in and it's going to help you make an informed choice. Okay, so let's get stuck in. So alcohol is a drug. It's a physically and psychologically addictive drug. It's a toxin. It's a poison. It's legal. Now, just because it's legal, it doesn't mean it's a safe drug, okay? I like to argue that alcohol is one of our most harmful substances. In fact, our most harmful substance. So there's a few things that people don't know about alcohol. One is that if you drink too much alcohol in one go, you can die from an alcohol overdose. Now, how much is too much? That's different for everyone. And we're talking about those sort of like binge sessions when we drink large amounts over a short period of time. So our body on average processes 1 unit of alcohol per hour. 1 unit of alcohol is like a 25 ml, one shot, a single shot of vodka, whiskey, gin, that type of thing. Half a pint of lager. Even a really small glass of wine, like 125 ml, is about 2 units. So that's like 60 ml of wine. It's like hardly anything, isn't it? So it's about drinking your alcohol slowly, which, let's be honest, quite a lot of people drink their alcohol quite fast, and that's when we can get into trouble with it. And the thing is, how much is too much? It can be different for different people at different times in their life. There are so many factors involved with this. And as we get older, our body finds it harder to process alcohol, sort of over 50s, definitely over 60s, yeah? So we become more concerned about people as they get older with the amounts that they're drinking. It becomes higher risk. So a bottle of wine a day for a 30-year-old, yes, I would want them to reduce for sure, but I'd be very concerned about somebody over the age of 60 drinking a bottle of wine, yeah? The other thing about alcohol that people don't know is that it is a physically and psychologically addictive drug. So that means that if you're drinking significant amounts daily and you stop suddenly, you may experience a physical withdrawal. So a physical withdrawal from alcohol can look like sweating, shaking, anxiety, paranoia, whole body shakes, hallucinations, night terrors, psychosis, fits, and it can be fatal. And this is why it's really, really important that when you are drinking larger amounts, that you are assessed by a medical professional, somebody who understands alcohol assessment and alcohol withdrawal, yeah, an alcohol specialist. Because alcohol assessment and assessing dependency is quite complex. There are many factors involved. It's not just about the amount of alcohol you are drinking. So how much is too much around physical dependency? Again, it varies. It depends a lot on your gender, your age, your size, medications, mental health, physical health. There's a whole heap of stuff going on there as well. But as a guideline, we tend to be concerned about women drinking 18 units a day, that's 2 bottles of wine, and men drinking 24 units a day, that's about 10 to 12 pints of lager. Now, if you are drinking that amount, it doesn't mean that you have a physical dependency to alcohol, but I would want to do quite a thorough assessment. And it may be that we would err on the side of caution and I would get you to reduce and just see how you get on, really, and see it just sort of manage the withdrawals, yeah? So alcohol, when consumed, goes into our stomach, it's absorbed into the bloodstream, and then it's distributed throughout the whole of the body. So there is no part of the body that is not touched by alcohol, yeah? Now, one of the things that we can say about alcohol as a drug is that it is a social lubricant. So, think it's a nice thing to do when you're meeting friends, to have a drink with a meal, that type of stuff. So think about appropriate use of the drug. Yeah, it can really, really help. And when we think about encouraging people to make better choices around alcohol. We're looking at people reducing, building alcohol-free days, thinking about how they use the drug, appropriate use of the drug, that sort of like social lubricant piece. Can you have a drink? Are you somebody that can go out and have one drink and enjoy that? Or are you somebody that sits at home and drinks quite a lot, yeah? And is using it to manage emotions and that type of stuff. So a lot of this is about being honest with yourself. It's also about education, hence why I talk about this stuff quite a lot, yeah? So alcohol causes chemical changes in the brain. It has a massive impact in the brain around our mental health, but also our brain function. There's loads of stuff going on there as well. It has a depressant effect on the brain, which has to readjust as the alcohol wears off. Now, because alcohol is a toxin, it's a poison, our bodies have to work really hard to get it out of our system. We're putting quite a lot of stress on our body. Now, genetics will play a part in this, and so will lifestyle, yeah? So this is where you see like some people are drinking a bottle of wine a day and they look like they're okay on it. They may not be. And then other people are like really struggling, you know, weight gain, skin problems, over acidity, anxiety, depression, you know, all that type of stuff. So there is genetic lifestyle thrown into the mix as well, yeah? But it isn't the whole picture. It's a bit of a lottery, really, yeah? Okay, so when we think about recommended guidelines, there is no safe amount for alcohol in the UK. So 14 units a week is what we recommend as, you know, harm reduction. What we want to see is some alcohol-free days. Now 14 units looks like a bottle and a half of wine a week, or maybe about 7 pints, depending on the percentage of the lager that you're drinking. Obviously we don't want you drinking that all in one go, because that would be a binge, which carries, you know, you're putting your body in quite a lot of stress there by bombarding you with alcohol. If you're doing that regularly, it might cause you some problems. Now, if optimum health is your goal, then no alcohol is the way forward. If you want to be healthier, the less alcohol, the better. And having alcohol-free days is really, really important part of this, yeah? So in the UK, we define a binge as being more than 8 units for a man. So that's just under a bottle of wine, and about 6 units for a woman, which is about 2/3 of a bottle of wine. So I think there's probably quite a lot of people out there that don't realise that actually they are what we would class as a binge drinker, yeah? And as I said, this is further complicated as we get older. So like over 50 and then definitely over 60, yeah? So we're looking at, you know, we're more concerned about somebody drinking a bottle of wine a day if they're over 60 than we would be. I mean, I'm still concerned about a 30-year-old for sure, but a 60-year-old drinking a bottle of wine a day would be more high risk than maybe a 30-year-old, yeah? Okay, so alcohol is a depressant, which disrupts the balance of neurotransmitters, your chemical messengers in your brain, and can affect your feelings, thoughts, and behaviours. Alcohol affects the part of the brain that controls your inhibitions, so you may feel relaxed and less anxious. That's the bit that we like about it, the social lubricant piece, and more confident after a drink. But in the long term, it can kill brain cells and lead to memory loss, yeah? So one of the things that we used to see, I used to work for DrinkWise Age Well, is that people would say that memory problems were just a natural part of aging, when actually we should be asking questions about alcohol there. You know, maybe alcohol is part of the story. The other part of this as well is that too much alcohol can dehydrate the body, which is really bad news for our skin, our brain function, our energy, and our sleep, yeah? So if you are, you know, if you're quite vain and you want to look good and you want your skin to age well, one of the best things you can do is massively reduce your drinking, hardly drink at all, yeah? And drink water. There is pretty much no point in you spending loads of money on lotions and potions, yeah? Being alcohol free is going to be the thing that massively helps your skin. And just to prove that, I am 56. check this skin out. It's pretty good, isn't it? Okay, and when we drink alcohol, it also impacts on our ability to get good quality sleep. It affects the REM sleep, which is the most important part, and your body needs deep sleep to repair itself. So this is also part of the picture, isn't it? If you're a regular drinker, you're not getting good quality sleep, you know, it's impacting on your energy, your brain function. You know, life's already difficult, it's already busy. It's like you're making everything so much harder for yourself, yeah? Drinking large amounts of alcohol over short periods of time can also cause irregular heartbeat and shortness in breath. So alcohol absorbed into the stomach, into the bloodstream, and the body processes about 1 unit per hour, yeah? Also, alcohol is very calorific. So if weight loss is important to you, if you're motivated by weight loss, then tracking your calories and your units can massively help. There's about 690 calories in a bottle of alcohol. You know, a bottle of wine, sorry. If you're drinking a bottle of wine a day, that's like 690 calories, like a roast dinner, an extra roast dinner every day, yeah? There is nothing of any nutritional value whatsoever in alcohol. It's empty calories. It's completely pointless. It's a drug, yeah? So you are using it because you want to get the effect, but it is also empty calories as well, yeah? So the liver breaks down most of the alcohol a person drinks, but remember, it only breaks down 1 unit per hour, and more than that, the liver struggles to cope. So that's why when we see that people are drinking quite a lot regularly, or then maybe they're binge drinkers, we're starting to see people with liver problems, yeah? So alcohol is implicated in over 60 diseases. It's crazy, isn't it? You go and buy this stuff in the shop, yeah? So the biggies that we see, so this is what I'm talking about, chronic drinking. So I'm talking about people who drink alcohol regularly over a period of time. And again, we can't say a specific amount, yeah? So I think there's a stat, and it's definitely an average. So if you're drinking 2 bottles of wine a day, you are potentially taking 20 years off your life. If you're drinking 1 bottle of wine a day, that's 7 years. And if you drink half a bottle of wine a day, which is 4.5 units, it's down to 2 years. So you can see why we're, as health professionals, we are massive fans of people reducing, yeah? So the biggies that we see around sort of regular long-term alcohol use are things like cancers, heart problems, strokes, liver disease, pancreatitis, and dementia. They're the biggies. What we tend to see before that are things like skin problems, weight gain, sleep problems, anxiety, depression, over acidity, high blood pressure, things like that, yeah? They're usually sort of they are signs that your body is not coping and there is something wrong, and the best thing you can do is reduce your drinking, yeah? Okay, so, and older people are less tolerant to alcohol because of the physical changes, such as a fall in ratio of body water to fat, meaning that there is less water for the alcohol to be diluted in, decreased hepatic blood flow, leading to weakening of the liver enzyme inefficiency, so alcohol will not be broken down as well as in younger people, poor kidney and liver function, and altered responsiveness of the brain. Alcohol affects older brains more quickly than younger ones. Alcohol depresses the brain function to a greater extent in older people, impairing coordination and memory, increasing the likelihood of incontinence, hypothermia, injury, accident, self-neglect. So falls is something that we tend to see in older people. So the Royal College of Physicians once estimated that perhaps up to 60% of older people who are admitted to hospital because of confusion, repeated falls at home, chest infections, heart failure, may have unrecognized alcohol problems, yeah? So it's like this silent thing that's going on. I'm a really big fan of us asking questions about alcohol, yeah? And it may be that these are just people that would see themselves as normal drinkers. They wouldn't, you know, there's all that stuff around, am I an alcoholic? You know, not seeing yourself as a heavy drinker because you're drinking a bottle of wine a day, but actually doing that regularly can cause massive problems. Yeah. Okay, let's talk about the chronic health impacts. Yeah. So these are the things that we see. So you're probably listening to this thinking, well, that doesn't apply to me because I don't drink that regularly, or I haven't been drinking for that length of time. Now, this is where genetics and lifestyle comes in. So I used to run alcohol treatment services. I've run 3 different treatment services, 2 of which were alcohol specific. One was for older people over 50s, and one was, you know, for the general population, and one was a drugs and alcohol service, as well as homelessness services and mental health services as well in there. Now, one of the things that we used to see is we did used to see young women. So women are impacted by alcohol more than men are, is something that we used to see. So we would see young women having quite serious problems with alcohol. So liver problems, usually liver actually. You know, I can remember a 25-year-old woman that we worked with liver problems. You know, a woman in her early 30s who died from an esophageal bleed. You know, it's the younger ones that really stick in your head. The more common things that we used to see, so we tended to see men in their 40s really having those significant health harms around alcohol, you know, the liver problems, the cancers, the heart problems, the strokes, the diabetes, the pancreatitis, stuff like that. That was around their 40s. And the same for women as well. And smaller women were very much impacted too. So it's not, yes, there are averages, but there are also anomalies. In the same way as that I've seen, you know, I've met an 80-year-old woman that's drunk loads of alcohol, you know, pretty much throughout her life. And she said that she was fine. I mean, we don't know if she was, but she was 80. So yeah, it's a bit of a lottery. There are averages, but it is also a bit of a lottery as well. But what we do know is that the less alcohol you drink, the healthier you are. Yeah, you're massively reducing your risks. Yeah. So liver, the damage caused by heavy drinking can range from fatty liver to cirrhosis. So sticking to the recommended guidelines can lower the risk of developing alcohol-related liver problems. So the liver is an organ with over 500 different functions, including processing, digesting food, combating infections, and dealing with toxins. Yeah. So by putting alcohol in there, you're just giving it a whole heap of stuff to do when it's already got loads of stuff to do as well. Now, while we're on the subject of liver, it can be quite difficult to figure out. You may not know that you have problems with your liver. So I always say to people, if you're concerned, go and see your doctor and ask for a full health check, and you'll get a blood test. Now, a blood test doesn't necessarily give you the whole picture. It might show something, and they might say, well, we'll test again in 3 months, because our levels will be constantly changing. The only way to really know if there is a problem with your liver is to have a scan. So if you're really concerned, either pay privately or insist on having a scan. Yeah, that is the best way to find out. Okay, so cancer. Drinking alcohol is a risk factor and contributing to 7 types of cancer. The more alcohol you drink, the greater the risk. And this is one of the things that I think people don't realise yet. We all know about smoking, we know about tobacco. And I've seen it this week actually with breast cancer awareness, where pink Prosecco is being sold for breast cancer awareness. I mean, it is just nuts, yeah? Alcohol will increase your cancer risk. So alcohol is a group 1 carcinogen, which means that there is enough evidence to show that alcohol causes cancer. Other group 1 carcinogens include UV, radiation, and tobacco smoke. The evidence shows that any amount of alcohol can increase the risk of cancer, but drinking 14 units a week or less will keep the risk lower. Okay? For some cancers, any amount of alcohol increases the risk. For other types of cancer, the risk only increases after drinking 2 or 3 drinks per day, around 26 to 35 units per week. So any amount of alcohol increases the risk of mouth cancer, upper throat and voice box cancer, food pipe esophagus cancer, breast cancer. Then drinking 2 or more drinks per day, around 3.5 units, increases the risk of colorectal cancer. Drinking 3 or more drinks per day, around 5 units, increases the risk of stomach cancer and liver cancer. Yeah. Cardiovascular health and blood pressure. So it's not uncommon for us to work with people that have high blood pressure and are on medication, and then they reduce their drinking and they can come off their medication and their blood pressure lowers. Bloody brilliant. Same with antidepressants. So cardiovascular disease is one of the biggest causes of death and ill health in the UK. Cardiovascular disease is a range of conditions affecting the heart and blood vessels. Lots of us want to know whether alcohol is bad for the heart or not, but the answer is not a simple yes or no, okay? So for many years, research has suggested that while heavy drinkers are more likely to suffer from a heart condition than moderate drinkers, non-drinkers also have an increased risk compared to moderate drinkers. In trying to make sense of this, some researchers have argued that this finding may simply be because non-drinkers usually include people who have given up drinking due to other illnesses, or because they have drank heavily in the past, making them more likely to be unhealthy. However, a number of recent studies have found that non-drinkers have an increased risk even after taking ex-drinkers into account. Most have found that the lowest level of risk for cardiovascular disease was for people who drink around 14 units per week. But the exact level found to be most beneficial has varied, and the beneficial effects may not apply to all people. For example, the UK's Chief Medical Officer's analysis finds that they only apply to women over the age of 55. So the research does not all say the same thing, but it broadly suggests low levels of alcohol consumption are linked to some reduction in the risk of particular heart conditions, for some people. However, so this is a question I get asked a lot about the heart health stuff, yeah. Oh, but it's good for my heart. And actually, we see some very well-known nutritionists touting this stuff, that a glass of red wine is good for you. Unfortunately, on balance, it doesn't really stack up. So yes, we have this thing and it's for very specific groups of people. Potentially, there needs to be more research done on this, but there are many other conditions that are impacted by alcohol, yeah? So remember I said to you about the cancers where some, any alcohol will increase your cancer risk. We've got stuff around dementia risk, we've got stuff around diabetes, pancreatitis, anxiety, depression, there's all that other stuff, yeah? So on balance, it's negligible, unfortunately, yeah? So cardiovascular disease is, of course, only one condition that may be influenced by drinking. So in the case of alcohol-related cancers, the risk increases from your first drink, and the more you drink, the more the risk increases. That means that any protective effects arising from low levels of alcohol consumption have to be balanced against the risks linked to other conditions, yeah? So it's worth bearing that in mind, okay? It's not okay enough to say that alcohol helps your heart health. That's just, gosh, yeah. That's just something in isolation. There are so many other factors involved in this, okay? So alcohol can also increase your risk of developing other conditions, which themselves increase the risk of stroke, such as diabetes, liver disease, and atrial fibrillation. The liver produces substances which make the blood clot, so damage to the liver can increase the risk of bleeding to the brain, yeah? Drinking too much alcohol can cause hypertension, also known as high blood pressure, and hypertension contributes to over 50% of cases of stroke in the UK. So diabetes Again, really important to drink less. It's an important part of your diabetes management, yeah. The brain, I've done a separate video on this, but just a bit of a whistle-stop tour. There are various ways that alcohol can impact on your brain, yeah. Alcohol and dementia. There is clear evidence that regular excessive drinking can increase your risk of developing the most common forms of dementia, such as Alzheimer's disease and vascular dementia. Frequent drinking in early adulthood may also increase your risk of developing early onset dementia. And long-term heavy drinking can bring about serious changes to our brains. So alcohol-related brain damage, yeah. Which is something that can happen over time. And that's why sometimes when people are regular daily drinkers, we're prescribing thiamine to help with that, yeah. And on the more serious end of that, stuff that we see is stuff around altered personalities, volatile moods, filling gaps in memories, problems controlling impulse, yeah. Then we've got the stuff around the stomach, because alcohol is a toxin, it's a poison, it's going into our stomach. It can cause massive problems for our stomach, yeah, and our digestive system. It irritates the gut, okay? So the less you drink, the better. So the stomach is one part of the gastrointestinal tract system that digests food, taking nutrition your body needs and getting rid of the waste. By adding acid and enzymes to food and drink you consume, your stomach breaks them down before they carry on their journey through the gut. So drinking alcohol is associated with acid reflux, acid coming up from your stomach into your throat, causing heartburn. There's some evidence to suggest that alcoholic drinks can make your stomach produce more acid than usual, which can gradually wear away your stomach lining and make it inflamed and painful, gastritis. Over weeks or months, this could mean you develop painful ulcers in your stomach lining. So super, super common. We used to see that most of the time, that people were struggling with over acidity and were prescribed medication for it, when actually they just needed to massively reduce their drinking, have a bit of alcohol-free time and eat a healthy diet, and this would help them sort their stomach out. Obviously, if that's left, it becomes more serious, and what we used to see was people with quite serious stomach problems as well. Alcohol can also massively impact on our ability to process certain nutrients. So something that I see quite a bit of is people being super healthy and eating loads of fruit and vegetables and nice, good quality proteins and doing yoga and then drinking a bottle of wine a day. It's like, yeah, okay. Alcohol and mental health. I've got other videos on this as well, but just a bit of a whistle-stop tour. People can get caught in a cycle of using alcohol to manage anxiety and depression when actually it's making it worse. You are adding fuel to the fire. So alcohol will increase, cause and exacerbate anxiety and depression. In fact, anxiety is one of the symptoms of withdrawal, which really often gets missed. You know, it's not uncommon for me to see people that tell me, you know, they've been trying to be alcohol free, they're doing a program that requires them to be alcohol free, maybe they want to be alcohol free, and they're not maybe even drinking a huge amount, maybe it's a bottle of wine, so they don't think they're a daily dependent drinker. And then they stop drinking, and day 3, day 4, they have this massive anxiety and it's just all too much and they need to start drinking again. It's a lot easier for that person to reduce over a period of time. It helps them manage the anxiety around the withdrawal. It makes things so much easier. So yeah, if you're experiencing any mental health problem, the advice is always reduce your drinking, build up your alcohol-free days, have a bit of alcohol-free time. Let's see what's going on with your mental health. 9 times out of 10, people feel better. And even if they don't, it's much easier for a practitioner to figure out what is actually going on with somebody's mental health. Yeah, it's not impossible. It definitely isn't, and I'm a big fan of working with the two together. Absolutely, I'm not somebody that insists we have to do this first all the time. You know, somebody sometimes will come to me with quite serious mental health problems. It's like, we've got to treat this as mental health. You know, this person needs medicating, and then we can sort the alcohol use. And the same goes for trauma, you know, EMDR. People can have EMDR while they're still drinking, and actually having the EMDR will help them reduce their drinking because you're sort of getting to the core of the problem, okay? But quite often, if it's not too serious, I'm wanting people to reduce their drinking, have a bit of alcohol-free time, and then let's see what's going on with the mental health. And it's so much easier then to be able to make a decision and make the appropriate referral for the person, yeah? And then we get into stuff around the acute risks. So what I mean by that is what happens when you drink alcohol and what happens on a night out, or if you're at home and you drink too much. So what happens in that period of time when you're drinking, you know, all that stuff that I've been talking about previously is about when we drink regularly or over a period of time. But that period of time and the amount can be different for everyone. So on a night out, you know, things that can happen are stuff around fights and violence and injury and criminal record, and the interactions with medications, accidents, alcohol poisoning, drink driving, unprotected sex, you know, putting people in vulnerable situations, suicide, falls. There are so many risks that can happen when we're drinking too much in one go, yeah? So I think that's it for now. Oh my gosh, that was a lot, isn't it? Any questions, please ask, and check out my other videos.